Regarding BOAST guidelines regarding arterial injury, the BOAST guideline states that the life-threatening injuries should be managed first. Hemorrhage should be controlled with direct pressure or tourniquet. Emergent reduction and repeat examination should be done. Do not delay any intervention, but a duplex and angiography is advisable. Assume pink pulseless limb to have an arterial injury until proven otherwise and involve vascular team. A devascularized limb needs urgent exploration. An amputation decision is by two consultants. First, restore perfusion with vascular shunts. Next, stabilize skeleton, then vein graft, and low threshold for fasciotomy. The ATLS guidelines, currently 10th edition, states that early transfusion is advisable. More than 1.5 liters of crystalloids is associated with mortality. Massive transfusion is defined as more than 10 units of blood given in 24 hours or more than 4 units in 1 hour. Tranexamic acid has shown to be effective in crash trial and it should be given within less than 3 hours. Base deficit and GCS are included in the classification of shock.